Good afternoon. Thank you for being here with us. I'm New York State Attorney General Eric Schneiderman, and I am truly honored to be joined by a great group of advocates and activists here today. Some are the heads of organizations, some are public officials, but everyone here is a true advocate and an activist in support of women's rights and women's health. We are united in our commitment to ensure that in New York, no woman is deprived of her constitutional rights and every woman gets the health care to which she is entitled. I'm joined today by Merle Hoffman, a wonderful ally and heroic founder of Choices Women's Health Center, where we are today, the great public advocate of the city of New York, Letitia James, Jean Bucaria, the Deputy Director of the National Organization for Women, New York City, Mary Elena Perez, the Chief Program Officer of the National Institute for Reproductive Health, and Elizabeth Adams, the Director of Government Relations for Planned Parenthood of New York City. And we are here at Choices today to stand up for the most fundamental of constitutional rights, the right to integrity, privacy, and protection of your own body and your own personhood. We are standing up against violence and sending a clear message that in New York, the laws protecting access to abortion and all other reproductive health services will be enforced. The decision to terminate a pregnancy is deeply personal. It is often painful. Sometimes a mother learns that her own life is at risk if she carries a pregnancy to term, but it doesn't matter what the reason is. The law guarantees that women are the ones who have the right to make that choice, not some men sitting in Albany or Washington. The law trusts women, and we are here to enforce that law. And for years, women who have come to this clinic, who have sought many different types of reproductive health services, have been confronted by angry protesters who are determined to stop them from exercising their constitutional rights and their legal right and their moral right to control their own bodies. And ladies and gentlemen, protesters really understates what we're dealing with. We are talking about vicious harassment, abusive language, threats, and physical confrontation. Every Saturday morning, protesters descend on this clinic and turn the sidewalk into an obstacle course. They obstruct the sidewalk with gory 3-by-5-foot posters. If a patient arrives by car, protesters will jam their bodies against the passenger side door to try and trap a woman inside. They thrust their heads and arms through car windows screaming. Protesters collide with escorts and patients approaching the clinic, pushing, shoving, stepping on their feet, sometimes pinning them against the outer wall. And they scream threats not only at women, but at children who are accompanying their mothers here as they seek reproductive health services. Protesters have been recorded saying things like, quote, "You can die at any moment. You don't know when you might get shot. Don't go in there. They will convince you to kill your baby. That's how they make money." This is quite simply an effort to terrorize women. You can see from the work of our undercover investigators, we have documented all of these tactics with video recordings that we are submitting to the court today and that will be made available to you by my staff. You can see from this one still photo how close they get, how upfront, in your face, and vicious this harassment is. We are here to get an injunction to ensure that this never happens again. And it goes without saying that the damage they do, even if a woman makes it through this phalanx, can be devastating. Women are traumatized and shaken by the encounter. They're in need of counseling. Some change their minds about getting reproductive health services, and we can only imagine the impact on the children accompanying their mothers who are subject to this sort of abuse. So I hope everyone agrees that these tactics are horrifying, but I am here to say, as your lawyer, they are also very clearly illegal. Thank you. A woman's right to choose, a woman's right to control her own body has been upheld repeatedly by the United States Supreme Court, by the courts of the state of New York, and there are federal, state, and local laws on the books, all of which have been upheld, to prevent anyone from obstructing or attempting to obstruct access to care at facilities like this one. Opponents of these laws, opponents of a woman's right to exercise her constitutional right to an abortion or other reproductive health services, have the right to protest and make their opinions heard. The injunctions that have been upheld here and across the country to impose buffer zones and protect women from this type of harassment always provide an opportunity for them to exercise their First Amendment rights. They do not have the right to blockade clinic entrances, accost patients, threaten violence in order to frighten, intimidate, and deter patients, healthcare providers, and volunteer clinic defenders, also covered by the law, from exercising their constitutional rights. So today, my office has filed a motion in federal court seeking an injunction to put a stop to the unlawful obstruction of this clinic. We have asked the court to impose a buffer zone around the clinic entrance where protesters will not be permitted this campaign of harassment. And as you can see from this picture, and it's demonstrated in videos we're submitting to the court, we need to have a buffer zone. It's close enough for them to voice their concerns, but it provides safety for the women seeking to exercise their constitutional rights. This will allow staff, patients, and volunteer escorts to approach and enter the clinic unobstructed and without fear of unwanted threats or physical contact. We are also seeking civil penalties and damages against 14 named defendants that we have identified and monitored who we allege violated our federal, state, and local clinic access laws on numerous occasions. Ladies and gentlemen, we are a nation of laws. We are not a nation where you can choose your point of view and choose your facts and choose your laws. The Constitution protects all people, and it guarantees women the right to privacy and the right to control their own bodies. I have been a part of the movement to protect those rights since I was 17 years old, when I dropped out of school to work at a clinic much like this one in Washington, D.C., a year before Roe v. Wade. And my career has gone on as a state senator. I'm proud of the work we did to pass the New York Clinic Access Act, which I'm seeking to inform today, which I sponsored back in 2009. That law was passed about 1 year to the date after a doctor who provided abortion services was assassinated in his kitchen outside of Buffalo, New York, Dr. Barnett Slepian. The violence and the threats and healthcare against women, against healthcare providers, against their advocates was real then, and it is real today. And we have seen in recent months a sense of entitlement by protesters to run their mouth and say the most vile, foul things imaginable with this bizarre sense that their hateful, unlawful, un-American rhetoric is somehow legitimized by the results of an election. It is not, and we will not stand for it here in New York. It should concern and offend everyone that women's rights are so easily and openly abused, and that a mob can use intimidation to try and block them. The motion we filed today isn't just what I believe or what I support as a matter of public policy and human decency. It is about enforcing the law. And as long as I am your lawyer, I will see to it that the rule of law is upheld and respected by all, no matter what their political or ideological views. The law and the facts are on our side. I'm confident that we will prevail, and I thank everyone for your great work here today. So, and now I'm very proud to introduce my colleagues here, starting with a true hero, Merle Hoffman, the founder of the Choices Women's Health Center.
Thank you so much. I'm going to change my glasses.
That's right.
It is. My heart is really very full just listening to you, and I think of Martin Luther King, who said that the arc of history bends, but it bends towards justice. And listening to you, I begin to see that justice, because we've had to live with this for a very, very long time. So thank you so much for your bold courage. In 1971, I opened one of the first legal abortion facilities in the country. This was 2 years before Roe v. Wade, when New York was only one of 5 states that legalized abortion before the Supreme Court decision in 1973. I have been on this struggle, on the front lines of this struggle, for almost 1/2 of a century. I have endured bomb threats, death threats, multiple evictions. I have witnessed the maiming and the murder of colleagues and friends. And I am still here. Choices is still here. I remember my first patient, and you know she came from New Jersey, just over the George Washington Bridge, because abortion was still illegal in New Jersey. She was pregnant, and she didn't want to be, and she was terrified. Abortion had been a crime and a sin, and now you could go into an office and receive services. I counseled her, and I held her hand during her procedure. And that intimate personal connection wed me to this movement and this struggle for my entire life. Today in New York, some people may be surprised to learn that although we have historically been a progressive beacon for reproductive justice, women and girls have to run a gauntlet of hostility, intimidation, just to access medical services. Now just imagine this. You've made a difficult personal decision to terminate your pregnancy. Perhaps your partner is with you. You walk out of the subway or you are dropped off in a car by the side of the road. And you're greeted by an entire military action. 15 to 40 people standing in front of the entrance, intimidating, yelling, chanting, screaming, surrounding women and children, pushing, obstructing their ability to enter the clinic. Others are busy taking photos of them. And there have even been times where we've had to use umbrellas to put over patients' heads to avoid photographs and digital attacks. Or perhaps you come in for prenatal care with your children, and before you know it, angry women are swarming around the children, creating nightmare visions of what supposedly goes on at Choices. The verbal, visual, and physical assault is so powerful that many women are traumatized and enter totally distraught. How dare they do that? How can they do that? They ask me, shaken and frightened. Some weep openly in the waiting room, others cry in the arms of my counselors. And my staff, all my staff, whose tendency is to protect and defend these patients, are frustrated and angry. What can I do? What can they do? We couldn't do anything until today. I made a personal silent vow to that first patient whose hands I held all those years ago that I would be here doing this work for as long as I was needed. I have kept that vow, and I am determined to enforce the existing laws. Rosa Parks and Alice Paul put their bodies on the line for suffrage and for civil rights, saying, this much injustice and no more. I and all the women in this country should rise up and say the same. This much injustice and no more. Thank you.
Thank you, and we have great advocates here, but only one who has that in her title, my great colleague in government, Letitia James.
I want to thank Attorney General Eric Schneiderman for bringing us all together to take action against this situation. And I also want to thank Merle Hoffman, who was told to end her practice, but nonetheless, she persisted. This brave woman who founded this critically important facility that has served so many women for over 20 years. And as a former city council member, I can recall referring women to reproductive centers all over the city of New York and have had to encounter some of these quote-unquote protesters. And it's rather unfortunate. It's unconscionable that any person would be subjected to harassment, to threats, and even physical violence while attempting to seek or provide medical care. And although there are some who thought that this was behind us, the reality is that given the recent elections, individuals now feel more emboldened. And so those protesters, unfortunately, are making the lives of women who basically have come to seek basic medical care, and the nurses and the doctors and the other staff, they've made them all victims of relentless and terrifying aggression and assaults and harassment and even physical violence. And women have been accosted and slammed against the wall behind us. And they've been violently violated simply because they are going to the doctor, because they dare to be in charge of their bodies, because they dare to make their own decisions. You see, women who don't control their reproductive rights, I argue, are not free. And I live each and every day and fight each and every day for freedom for all. These demonstrators have violated the boundaries of free speech, and they've entered into an illegal and criminal space, impeding access to basic health care. But today, thanks to the people's lawyer, Attorney General Eric Schneiderman, these instigators will finally have to answer for their offensive and illegal behavior. And so let this lawsuit serve as a loud and clear message to any person who tries to threaten or violate the rights of any New Yorker, anyone who impedes their right to basic health care, that all of us will stand up and fight back. And there is nothing more powerful than women with made-up minds led by a very, very, very powerful feminist attorney general by the name of Eric Schneiderman. That we're going to protect our rights and the rights of all women who basically want freedom. This type of behavior will not be tolerated, not in New York City and not in New York State. And unlike some in Congress who believe that women don't deserve health care and that it's not a right and that it's a privilege, and unlike some in Washington, particularly those at 1600 Pennsylvania Avenue, who think it's okay to violate women, I say no. And so here in New York, you will always have the right to affordable and accessible health care. And I want to thank the Attorney General for his work, and I also want to acknowledge Merle Hoffman and all of the angels, all of those who work at this facility for doing the work of the angels each and every day and for protecting women and for standing up for what is right. I thank you. You have dealt with these problems for 5 years, and despite the fear and the trauma, you have continued to do your job because you know just how many women depend on you and depend upon your care. And so thank you for your bravery and your dedication and your commitment to freedom and equal access for all.
Thank you. Thank you. And now the Deputy Director of the National Organization for Women, New York City, Jean Bucaria.
Thank you, Public Advocate James. Thank you, Merle, for your trailblazing spirit and what you've done. Today we commend and thank Attorney General Schneiderman and his team for holding individuals accountable for egregious behavior that aims to deny women access to the health care that they need. This lawsuit and establishing a buffer zone will go far to protect the health and well-being of women, patients that rely on choices for their medical care, as well as the volunteers and staff that are there to support them. 5 years ago, Now New York City and our sister organization, Women's Justice Now, partnered with Choices to recruit and train a team of volunteer clinic escorts to be here on the sidewalk to support patients and their families entering the clinic. And what our volunteers have witnessed and documented and experienced over those 5 years makes very clear just how much their presence has been needed. Just as you heard, right here on this sidewalk, we have had so-called protesters yelling things about murder and killing just feet from patients' faces. They have walked patients into the wall. They have surrounded patients trying to get out of their vehicle, pulling up for their appointment. They have surrounded patients and brought them to tears. This is not what we talk about when we talk about conversation and free speech. This is harassment. It is a gauntlet. It is menacing. It is hostile. And it is disturbing. And no one should have to be subjected to this type of following and harassment just to reach the door of their doctor's office. Yet, and what wasn't said is that what's so amazing about Choices is that they serve everyone. They serve immigrant women, incarcerated women, women of color, low-income women, women who have nowhere else to go. And yet these women, these are the women who must face this gauntlet to get the medical care that they need. Well, we are hopeful that the blatant flouting of our laws is going to come to an end. And today we thank Attorney General Eric Schneiderman for taking action to stop this, especially in this era of Trump, where our reproductive rights are under attack every day, where our access to abortion and our access to birth control is being diminished across the country. Well, here in New York, we're standing up. We are sending an unequivocal message that the bullying and harassment of patients is not tolerated in our state, in our city, and certainly not on this sidewalk. Thank you.
Thank you.
Thank you. Thank you. And now we're joined by Maria Elena Perez, the Chief Program Officer for the National Institute for Reproductive Health.
Thank you. And actually, first, I want to echo the public advocate's words and just want to commend and thank the clinic staff and their bravery. And as we were walking out, they said, like someone from the clinic, commented, "Wow, look at all these powerful women." But I say the powerful women are you all for being in here and the dedication and the commitment that you all have to the people that walk through those doors every day. And I'm really proud here today on behalf of women of our state, and as well as those women who are forced to travel to New York for abortions because of onerous restrictions in their home states. We're so grateful for the Attorney General, Eric Schneiderman, whose leadership is protecting and advancing women's rights in our great city. This is a tremendous victory for New York. For the first time, these violent extremists are being charged under New York City's 2009 Clinic Safety Ordinance. These individuals will no longer be permitted to threaten, bully, obstruct, or commit violence against women accessing abortion care. This sends a message to would-be extremists, not just at Choices, but at every clinic across our city. New York City is committed to protecting the rights and safety of patients, clinic staff, and volunteers. We've all seen what's happening at the federal level. The Trump administration is rolling back the rights of women, with low-income women and women of color bearing the brunt. The Attorney General's case ensures that regardless of what happens in Washington, New Yorkers will be able to safely access the full range of reproductive health care services. Local efforts are more important now than ever. We hope this will inspire other cities and states to follow New York's lead in protecting clinic access. The National Institute has worked hard to advance clinic access in New York City and in cities across the state and country for nearly a decade. This is truly one of our proudest moments. Thank you again.
Thank you.
Thank you. And finally, we'll hear from Elizabeth Adams, the Director of Government Relations for our great colleagues at Planned Parenthood of New York City.
Good afternoon. My name is Elizabeth Adams. I'm the Director of Government Relations at Planned Parenthood of New York City. Thank you to the Attorney General for having us here today, to Public Advocate Tish James, Merle Hoffman, and to the escorts, clinic staff, advocates, and patients who helped make all of this happen. At Planned Parenthood, we know that abortion is health care, and that health care is a human right. All patients deserve access to the full range of reproductive health care services without being threatened, assaulted, or made afraid for doing so. Yet we are in a moment when clinic staff and patients are facing heightened violence, like the active shooter in Colorado, the arson attacks on Planned Parenthood clinics last year, and the increasing aggressive protester activity we've seen across New York City health centers this past year alone. Center staff and escorts know how high the stakes are, and yet they continue to do everything they can to support their patients. I had an abortion at a health center very much like this one, and I can tell you that no one deserves to be verbally harassed about their decision or shown traumatic photos as they walk into a clinic or have their doors blockaded as they try to enter. The AG's suit recognizes that patients don't deserve to be punished for accessing abortion. It'll also be the first time that New York City's 2009 clinic access law will be put to the test, helping clarify what constitutes harassment, which is not always enforced, and puts patients and providers at risk. PPNYC is so proud to stand here today with the staff and escorts of our fellow reproductive health center choices in fighting for the right to safe and legal abortion and to the right to access health care free from assault. We hope that this suit will bring increased assurance and protections for the patients, escorts, staff of this health center, and serve as a guide and a beacon for others across the city. Thank you.
Thank you. Thank you all, heroes, angels, my legal team, and the investigators who've made this possible. And with that, if you'll identify, members of the media, identify yourselves to Amy, she will take some questions. Well, fortunately, we're not writing on a blank slate here. Buffer zones have been approved repeatedly by courts. We're seeking a 16-foot buffer here because that's just the length, the size of the sidewalk. That brings people perfectly close enough to express their views. Buffer zones like this have been upheld repeatedly. In fact, a U.S. Supreme Court decision a few years ago, which struck down a broader buffer zone, noted with approval New York's system of buffer zones in the area of 15 and 16 feet. And this is something that now that we have what I think is overwhelming evidence of conduct that violates the federal, state, and city law, we will have no problem establishing a buffer zone, and then that's just up to a matter of enforcement. But this has been done in cities across our state and across our country for years. This is not something we don't know how to do and that local law enforcement does not know how to do. The NYPD has experience in this area, and we work closely with them. It will prevent this kind of harassment. I mean, it enables people to come and go without their egress being blocked. This is a careful effort to tailor people's right to express their point of view, however much we may disagree with it, but to stop the physical intimidation that has been taking place here. And it is not free of physical contact. We have people who step on the feet of patients and escorts. We have people who physically crowd them and grab their arms. So this is something that goes beyond verbal abuse, and that will not be possible with a buffer zone of this kind. This is something that has been litigated. It is as old as the First Amendment that proper restrictions on time, place, and manner of speech are totally lawful. I mean, there are many things that are speech that are restricted by the law. A blackmail threat is speech. That doesn't mean it's protected by the law. Fraud is speech, but it's not protected by the law. So you are not allowed under the federal, state, and city laws that we are enforcing here to harass, intimidate, and try and prevent people from exercising their constitutional rights. This has been all the way up to the U.S. Supreme Court. It has been upheld. We will accommodate their First Amendment rights while keeping women safe to exercise their equally valid constitutional rights to an abortion if they so choose. So this particular application is limited to choices, but we think it's going to send a very powerful message. We've spent a lot of time working with the clinic staff, documenting what goes on here, and we have had cases like this. We've dealt with them in other parts of New York State, in Utica and Buffalo. This is a very powerful set of evidence, and this should send a very clear message to groups all over the state. And we will not hesitate to take further action, but it's important to have folks who are willing to speak up and step up, and the staff and the people here at Choices have been willing to do so. A lot of patients and people who work in clinics, in fact, are sometimes hesitant to speak up. It's another example of the courage of the folks standing with me, that they have been willing to speak up, to put themselves out there, and that enables us to make this case. No, we think this is totally in keeping with past precedent, but we do think it's going to establish something that is capable of repetition at any other clinic where conduct like this takes place. This is a civil complaint. We're seeking a preliminary injunction. The first priority is to make this safe for women. We also are going to seek civil damages and penalties, which are provided for under the law. Well, we just filed our papers today, and I'm sure we will have a response. I've not seen it yet, but we welcome their response. Well, there have been criminal charges in connection with some bad actors at family planning clinics. I mean, fortunately, in New York, it's been a while since we've had a serious criminal case. I mentioned the murder of Bart Slepian, which obviously was criminal. We've had arson, we've had vandalism, we've had other shootings and assaults, and if the conduct rises to the level of criminal conduct, we have no hesitancy about pursuing that. But I'm happy to say, and I hope this remains true, that has not been the case of late here in New York. To the extent that it's necessary. Once we get an injunction, it is enforceable under the law, and we are hopeful that the protesters will respect the law, but to the extent that we need to get enforcement by local law enforcement, that's something we've done in other jurisdictions in the past. As someone who spent years of my life actually as a lawyer for the Strap Hangers campaign, I have a lot of experience with various summers of hell and other unconscionable acts. We are entering a new period of crisis in our mass transit system, and it is not going to be dealt with by putting the burden on individual employees. It has to be dealt with by those in power. The defunding of the capital plan for the MTA goes back into the 1990s. I was in court over the years on issues related to this quite a few times. But I think that the level of public awareness and outrage right now is precisely what is necessary to move this issue forward. What we need is investment, and what we need is expansion. And we're now paying the price for too many decades of inaction. But I do not think the burden should be on individual employees or frankly on individual employers. They're all victims of governmental malpractice as far as I'm concerned. This is something that is as much of a problem for employers as it is for employees, because it's not one or two employees who are having trouble. It's our entire city workforce that's now having trouble. This is not a small problem, and it requires big solutions. Thank you.